We'll now move on to part 2 of today's session with a discussion on the supply chain resilience for influenza vaccine studies. And for that, I'd like to introduce our chair of that report. We'll be hearing from Dr. Ravi Anupindi, who is Colonel William G. and Ann C. Svetlich Professor of Operations Research and Management at the Stephen M. Ross School of Business at the University of Michigan. Welcome, Dr. Anupindi, and I will turn it over to you.
Thank you, Stephanie. Good morning, good afternoon, and good evening, wherever you are. It's my pleasure to present to you our findings and recommendations on globally resilient supply chains for seasonal and pandemic influenza vaccines. Next slide, please. So first of all, I would like to recognize our co-chair, Prashant Yadav, as well as the committee members who came from varied backgrounds with lots of deep experience from industry as well as academia. And it was really appreciate their taking time from the busy schedules to participate in our meetings. I would also like to recognize the Academy staff who really worked extremely hard to make this possible. So really appreciate that. Next slide, please. So what I'll do is, just like the other committees, walk you through the statement of task first, and then outline how the report is structured and walk you through some findings and recommendations. Next slide, please. So we had a fairly extensive statement of task broken into about 7 pieces. Number 1 was to review recommendations for pandemic vaccine manufacturing, following SARS, H1N1, Ebola, COVID-19 responses, etc. The second was asking us to identify what were some of the enabling factors for national vaccine distribution readiness that facilitate equitable distribution and efficient use of resources, including in low-resource countries, to talk about, cold chain infrastructure, immunization frameworks, etc. Next slide, please. The third item in the statement of task was to identify critical gaps in vaccine delivery, which gets into details of supply chain about managing inventory, managing resources like cold chain, etc., and what kind of delivery platforms are there for actually doing the immunizations. Task 4 was around manufacturing of vaccines itself. That is, what are some of the critical inputs that go into influenza manufacturing? And what are some of the existing mechanisms for tracking these inputs? It's not enough just to have the final stage of production. We need to look at all of the components that go into vaccine manufacturing. So that was statement task 4. Next, please. Now, statement task 5 asks us to identify novel technologies and advances in translational research and science derived from the current pandemic that can be adapted to scale up and sustain influenza manufacturing and distribution. So going from research to manufacturing, that interface, how do we look at that? Statement task 6 asked us to identify what were some of the barriers for the scale up of manufacturing going from clinical trials to scaled manufacturing from pandemic vaccines, and what strategies could we recommend? So while 6 asked us to identify the barriers, 7 then went one step further to say what kinds of incentives could be devised to effectively encourage investments in vaccine manufacturing. So these were, fairly extensive set of tasks that we had. Next slide, please. Now, before I get into I just want to make some highlights of the nature of, the task that we had while we were asked to look at, previous SARS and, H1N1 kind of epidemics. But here, a lot of the lessons derived are from COVID-19 experience. And the challenge was that we are still learning lessons through this because it's not over yet. And so including all of supply chain and manufacturing. Number 2, the committee really tried to balance off the lessons learned, balance of the roles of responsibilities of United States and global actors. It's not always easy to identify the global actors because we're still living through this as we manage the COVID, and the experience of COVID is really very, very new. the final thought on the recommendations is that from a deployment distribution of vaccines perspective, this is when we get into, in country, they are very context specific and there is a lot of heterogeneity across countries. So we didn't get into specifics of each country, but stayed at the higher level in terms of what kind of frameworks and what kind of common issues arise as we think through this. So that's kind of at the high level, the summary of recommendations. Next slide, please. Next slide, please. So before I discuss, what the recommendations in this webinar, just want to say that we had 7 items in the statement of task. The way we organize this around in terms of chapters, there are 6 chapters. Chapter 1 is summary. Chapter 2 gives some introduction of the vaccine manufacturing and distribution as overall. But chapter 3 to 6 is where we get into findings and recommendations. But we started from left to right, if you think about from vaccine manufacturing. So chapter 3 focuses on all of the inputs that go into vaccine manufacturing, and the recommendations around those. Chapter 4 then gets into distribution issues in country, globally as well as in country. So those are the physical distribution piece of it. Chapter 5 then focuses on what kind of preparedness frameworks exist, what needs to be done, where are the gaps, etc. So that's chapter 5. And finally, chapter 6 gets into the issues around barriers and incentives to ensure scale up of vaccine manufacturing and sustainability of vaccine manufacturing. So that's how the different chapters are organized. We had, given the extensive nature of the statement of tasks, we had quite a few recommendations. Obviously, we'll not be able to cover all of those in this webinar. So the numbers that are listed there are select recommendations that I will cover in this webinar. And of course, you have the report accessible to you to look at all of the recommendations. Next slide, please. So switching to chapter 3, which is focused on the critical components, few key findings: that global vaccine manufacturing requires timely access to hundreds of items produced by several manufacturers across dozens of countries. So this is truly a global endeavor to get all of the inputs together. Components, which means that the components must be defined, identified, and managed for both seasonal and pandemic influenza to ensure uninterrupted and timely equitable vaccine supply. This is where the set of countries that have this production capacity of inputs as well as vaccine manufacturing, trade barriers, and other kinds of interruptions could put a dent in how we can ensure supply in the vaccine supply. So what is needed is a well-coordinated global body with an inclusive governance structure that will play the role of orchestration. So we emphasize the word orchestration of such a globally distributed supply chain to produce influenza vaccines. So these were some of the key findings coming out of the chapter 3, which was focused on vaccine manufacturing. Next slide, please. This is just a graphic to show you, illustrate different components that go into vaccine manufacturing and highlighting the set of countries where the capacity exists, and just to kind of highlight the global nature of it. And therefore, any disruption in production of any of these inputs will hamper our ability to produce vaccines. Next slide, please. So the very first recommendation that we make is that G20 should constitute what we call a global pandemic manufacturing supply chain task force. And this task force, as a permanent structure, governed by a globally inclusive body with technical responsibilities to ensure global pandemic influenza manufacturing and supply chain preparedness and response. So this is a task force whose main focus will be around ensuring that all of the inputs into vaccine manufacturing, as well as the vaccine manufacturing fill and finish capacity, is well orchestrated so that we have sufficient supply of vaccines. Such a task force will include in the governance structure both relevant agencies, United States, as well as international governmental agencies, but also will include industry associations, private philanthropic organizations, and international NGOs as well. So that's recommendation 3.1. Next slide, please. Then we go in the rest of the chapter, we're going to highlight some of the recommendations and call out some specific actions for United States agencies to provide technical and resourcing support to the committee's recommended task force. And the idea for this task force is they need to develop a comprehensive pandemic preparedness and response capability framework. What should that framework have? Typically, three things. We need to have end-to-end visibility of all the critical inputs produced across the globe, different countries. And once we have visibility into those inputs, how much capacity exists, who produces what, the second task would be to do an assessment of resiliency. Where do we have capacity gaps? Where do we have bottlenecks? And once we do that analysis, then this body can then think about what are some mitigation measures that can be done ex ante as part of a preparedness task. So the third capability should be thinking about preparedness, thinking about response, as well as structures for global coordination across all of these different players for inputs as well as vaccine manufacturing. Next slide, please. As we thought about critical inputs in our committee, we thought that not just physical inputs, but workforce is an extremely critical input for ensuring that we have sufficient capacity to produce vaccines. So this recommendation is focused on that, about what the government agencies, commercial entities, academic institutions, et cetera, need to do to ensure that we have vaccine manufacturing technology and technology development hubs where training can be conducted. And then we are asking that the HHS as well as technical agencies, including non-governmental partners such as PATH, to develop and implement a medical countermeasure university for training a vaccine manufacturing and delivery critical workforce. So the idea is that we recognize that workforce, in addition to physical inputs, are extremely important. So we had a strong recommendation just highlighting that. Next slide, please. There's been a lot of talk, even in the other committees, if you were there in the morning as well, about the need to have a globally distributed network of vaccine manufacturing capacity. While we do not make specific recommendation about what such a manufacturing network would look like, but what we are calling out is this task force that we have asked in recommendation 3.1 that they should look into evaluating the feasibility, the structure, and sustainability of such a network. Technology is changing quite a bit. We have legacy technology, we have new technologies. Each of those technologies have different characteristics, and therefore what this network would look like, still needs to be determined as we evaluate these different technologies. So that's recommendation 3.5, to do some research to figure out what this network should look like. Next recommendation, please. Sorry, next slide. Yeah. So now we wrap up chapter 3, which was on manufacturing, and we get into distribution and delivery. Some of the key findings here, really 4 levels, if you think about this, is first is the resources needed for distribution and delivery depend largely on the vaccine characteristics. As we have seen, the resources needed to distribute mRNA is very, very different that requires ultra-cold infrastructure, et cetera, versus the other vaccines. So recognizing that the design of the vaccine itself has a huge impact on what we will need downstream in distribution and delivery. Second finding was that countries need access to a broad portfolio of vaccines to adopt, because they know best what is suited for their populations and the distribution infrastructure that they have. And therefore, access to a broad portfolio becomes very important. So if you think about the first one is around design, the second is portfolio, third gets into the physical infrastructure. And what we have seen is the main bottlenecks are cold chain logistics and transport capacity, the primary bottlenecks in vaccine distribution. So once a country knows which vaccines they're going to deploy, they can review and assess how much of cold chain infrastructure and transport capacity they would need. But in addition to the physical infrastructure, we need the information architecture as well. So there is limited data on global vaccine distribution, how it contributes to challenges in vaccine planning. So bottom up in terms of what's happening on the ground in terms of distribution, how can data be captured to feed upstream, further up to inform better planning both at the country level as well as global planning in terms of how much vaccine needs to be produced. So these were some of the key findings, and the recommendations are structured around that. Next slide, please. So this is more of a broader recommendation to highlight the need to recognize a systems approach to design and development of vaccines for feasible distribution and delivery in various global contexts and support relevant innovations. So I want to kind of emphasize, the committee wanted to emphasize the systems approach. That is, the first finding that design of vaccine impacts downstream distribution delivery issues. So the follow-up recommendations from this recommendation 4.1 was around how do we make the different stakeholders aware of these challenges. So what does it mean for funding vaccine development? How do we kind of get that surfaced during clinical trials? What kind of investments need to be made to think about stabilization and delivery platforms? Because some vaccines, that's beyond vaccine development that could be done. So these are different ways to think about how do we ensure feasible distribution delivery. This is what is encapsulated under what we call a systems approach. Next slide, please. We move on to chapter 5, which focused on what are some of the frameworks, tools, and innovations for distribution readiness. Some of the key findings our committee had was many countries lack frameworks for pandemic preparedness and vaccine introduction. Existing frameworks do not look to be suitable for mass vaccination campaigns. We also need improved tools for in-country allocation, distribution, administration. And finally, trying to think about how to engage the private sector for planning could advance pandemic preparedness. Because what we are going through in the COVID is not only just COVID and impacting the health sector, it's impacting the entire country's economic infrastructure that impacts the private sector. So the private sector has a lot of capabilities that could be leveraged both in planning and preparedness. So I think this was some of the things that we discussed in our committee. Next slide, please. So the first recommendation in chapter 5 would be to these global agencies to come together, periodically convene. So it's not like one-time convening, periodically convene to identify challenges in global preparedness for influenza, as well as overall preparedness for emerging pathogens, benefiting from lessons learned, right? So the outcomes of these meetings should be to inform national authorities on approaches and best practices to prepare and periodically update their national preparedness plans. It's not just enough to have preparedness plans once done, but to have a periodic cadence to update them based on new information that comes in, new technology that comes in, etc. Of course, this will require technical support from different agencies. We need to ensure that plans are of high quality, they're granular, relevant, and actionable. And finally, we also call for national authorities should be encouraged to engage with the private sector for pandemic preparedness and response. Next slide, please. One of the things that we found during COVID-19 is that it's not just the classical health agencies, whether it's WHO, UNICEF, and Gavi that engage in this, but you also have the financial institutions that are engaging, the World Bank, the IMF, other development financial institutions, regional organizations. They're all engaging everybody's coming together to help solve the problem. And yet, sometimes what you see is there needs to be coordination across these agencies, coordination in terms of how do they do assessments of country readiness, et cetera. So what we're calling for is an independent convening to get all these agencies together to share updates from evaluating the tools used to respond to COVID-19 vaccine rollout, identify current capabilities, constraints, and gaps, and to harmonize country assessment methodologies relevant for different stakeholders. The last thing we want is a country to respond for one set of assessments to the World Bank and a different set of assessments to a WHO or somebody else. So to the extent that these can be harmonized, it just makes the life of it makes it easier for the country to abide by some of these assessment methodologies. Next slide, please. So here we go one step further. Some of this discussion has come up in the previous webinars about countries are sovereign. We can give guidance in terms of what they should do in terms of preparedness. How do we ensure that they will actually do comply? How can we incentivize country compliance? So recognizing that a pandemic, just like what we are going through right now, has much broader impacts than in the health sector, not just health sector for COVID itself, but COVID has disrupted the delivery of other health services as well. So what we are calling out is other programs that the U.S. Government has through USAID or PEPFAR programs, that U.S. Congress should authorize government agencies and programs to include pandemic preparedness as an input into country funding proposals. That is, it should be everybody's task to think about whether the country has the preparedness plans or not for various health programs. And if there are gaps identified, then those deficiencies should be supported through technical assistance and financial support, as even in other programs and not just for pandemic influenza. Similarly, when global institutions like the World Bank, IMF, or IFC, they are doing their development initiatives with the countries, they should integrate country preparedness assessments into their country economic assistance programs, because economic development is also at risk when we have a pandemic. Next slide, please. We were asked to look at some of the innovations that came out of the pandemic, of course, still ongoing. We do identify some in the report, but we ask that there needs to be a comprehensive review of the innovations developed. Some of the innovations at the global level are well documented already, but there are lots of innovations happening at regional level and local level that still requires, a systematic review and capturing some of those innovations to also see where the gaps are for a future pandemic preparedness and response. Next slide, please. Finally, coming into barriers, incentives, and innovation for sustainable mechanisms, a few key findings we have is that we need novel vaccine technologies are needed to produce more effective influenza vaccines in shorter time frames, because we have limited time when a pandemic hits. Therefore, we need to figure out new technologies that can get us there quickly, and the vaccines are more effective. The second finding was that liability and risk faced by manufacturers, along with the lengthy regulatory review, are also barriers to innovation. So what can we do to somehow mitigate some of these liability and risk that manufacturers face? And finally, transparency of clinical trial process is important for increasing vaccine acceptance and therefore demand, because if there is a challenge in terms of vaccine acceptance, obviously that impacts demand. So these are some of the key findings, and our recommendations are structured around these findings, but I will only capture a few of those in the webinar given the time constraint I have. Next slide, please. So coming up with this liability mechanism, talking about this liability mechanism, et cetera, we reviewed what the current structures exist. And there are the three structures that they currently have, which the factors include how are they funded, who is eligible for this, what is the eligibility criteria, how are they administered, and what elements of compensation are being captured. So that is what this table kind of highlights. But what we recognize as a committee is that a no-fault compensation mechanism is really a key tool to reduce the risk taken on by manufacturers during vaccine development, especially when using novel platforms. So while we review these three systems here, in one of the recommendations we call out is that there needs to be some global indemnity mechanism, regardless of how the country actually sources or procures those vaccines, which mechanism they use to procure vaccines, whether it is a COVAX type facility or in a bilateral arrangement. There needs to be one standard global indemnity mechanism that they can use that could mitigate the risk for the vaccine manufacturers. That will incentivize the vaccine manufacturers to quickly scale up vaccine manufacturing. Next slide, please. So I'll just close with just one recommendation. Of course, Chapter 6 has many recommendations. I'll highlight one of the recommendations, which is, given a lot of the new technologies that have come into effect during this COVID-19 pandemic, what we are calling for is a comparative assessment of all the available and potential manufacturing technologies for influenza vaccines. And we're talking about here the assessment around, so metrics for assessment could include, speed, how quickly can this technology be scaled, complexity of scaling that technology, How scalable is it? How much flexibility exists? Recognizing there was a lot of talk in the earlier webinars as well about sustainability. If a platform is flexible that could make other kinds of products as well, that helps in terms of sustainability. So we need assessment of these different technologies for their potential for mass production. Once we have this assessment done, that should inform a decision-making framework not only for future investments in those technologies, but going back to a recommendation I in the context of Chapter 3 that I talked about earlier, that would then also inform what kind of distributed network do we need to build globally, because the technology capabilities inform the nature of the distributed network that we need to build. Next. I think that's the end of my formal presentation. I would like to now invite my co-chair, Dr. Prashant Yadav, to offer some comments. Prashant, over to you.
Thank you, Ravi, and thanks, first of all, to all of you who are joining, and also to our committee members who, like Ravi said, come from deep expertise in different aspects of manufacturing, regulation, funding of research for manufacturing. You'll hear from some of them in the Q&A session in a few minutes. I want to stress 3 points. One is that when we in this committee talked about what all needs to go into building resilience in influenza vaccine manufacturing and supply chains, in both pandemic and seasonal influenza, but also more generally for vaccine manufacturing and supply chains, we thought that it starts with good data on a number of things. It requires systems thinking, and systems thinking implying regulatory, quality, critical inputs, lots of things that you would see appear in the recommendations that Professor Anupindi just described. And along with that, a very well coordinated risk management structure. You'll also see that the enablers for making such resilience occur in vaccine supply chain, those enablers include things such as indemnity or preparedness plans, or some areas where you might say, well, this is getting into financing or indemnity is one particular example. So, but the reason we got deeper into some of those areas was that unless the enabling environment for the supply chain was in place, it would not be feasible to talk about a sustainable, resilient vaccine supply chain. So we did delve into some of these areas, which were in a way adjacent or auxiliary to the core remit we were focusing on. I also want to remind us that there are many parts of this which are dynamic, especially because the global structure for pandemic preparedness, financing, manufacturing are evolving, and lots of discussions are in play currently. So in places where there are ongoing discussions, such as what will be the future of new task forces that have been established, or what is the nature of new financing that will be used, how will it be organized, other structures that are evolving for global coordination partnerships, including for vaccine manufacturing and preparedness. So I think at times the recommendations of this committee will have to be viewed in recognition of the idea that there are aspects of structure that are evolving, of financing that are evolving, but I think the core principles in the recommendations will still remain as they are. There might be areas where it might be worth looking at those. Thank you.